Welcome to Chapter 4 entitled Pharmaceutical Care and Patient Counseling. Counseling is an important part of pharmaceutical care to influence patient behavior and adherence. The concepts described in this chapter are a proposal of counseling skills in pharmaceutical care. More than assuring expected medication outcomes, adequate counseling requires communication and relational abilities as tools to provide the best patient care possible. Counseling aims to set a permanent cooperation with patients, thus favoring patient empowerment, self-caring abilities, medication adherence and improved health-related behaviors. Next we will discuss counseling, paying attention to definition and scope. Counseling is widely recognized as part of the pharmacist's professional role. It emerges naturally from pharmacists' duties towards people receiving medicinal products as well, providing advice to help patients with the use and management of those products. Counseling can be defined as a process of interaction between a specialized professional and a client, aiming to help the client to clarify and make the right decisions. It is an active and person-centered exchange process, based on a trusting relationship between the professional and client. Counseling assumes that each person has the necessary resources to address the decisions and actions needed. The professional needs to master the abilities necessary to retrieve that person's resources, fostering support and promote the right knowledge and behavior. In pharmacy practice, counseling may arise from a patient asking for advice, or from the duty to provide information to patients, significant others or other healthcare professionals. Providing advice usually emerges from uncertainties about an appropriate course of action or knowledge, while the usual pharmacist's duty of information provision has no personal implication for future action. Information, such as directive and factual instructions that should be followed during a drug treatment, tends to receive minimal acknowledgement. This way, the actual relevance of counseling is in the interaction itself, rather than on single advice or on the accuracy of the information being provided. The International Pharmacist Federation, abbreviated as PHIP, refers to medication counseling as an approach that focuses on enhancing individual problem-solving skills for the purpose of improving or maintaining quality of health and quality of life. It is expected that the pharmacists will provide and discuss medication information, respecting the physical, psychological, socio-cultural, emotional and intellectual perspectives, health beliefs and values of the individual. The healthcare professional's responsibility is to support the client's efforts to develop medication management skills and to move in the direction of self-responsibility. This requires empathy, sincerity and patience. To further understand pharmacists' counseling, one may follow another definition offered by the American Society of Health System Pharmacists' Guidelines on Pharmacist-Conducted Patient Education and Counseling. Here, besides medication-related content such as drug names, expected actions, route and dosages, there is an overall concern with the counseling setting. Environmental features, e.g., room or space ensuring privacy, and especially the process steps, such as those assisting an effective patient interview, e.g., introducing yourself, assessing patient's knowledge, providing information and guidance to reach a decision, etc., are some of the preconditions to adequately counsel a patient. This will be addressed in more detail later. There are several advantages emerging from pharmacists counseling patients to both patients and pharmacists. From the patient's side, they become more capable of making informed decisions concerning the appropriate treatment with prescription and non-prescription drugs, including suitable responses to adverse drug events. Adequate counseling favors the patient's understanding of the usefulness of medicines to maintain or promote well-being, contributing to them participating in their own care. This encompasses an important contribution to patients' functional health literacy, i.e., the patient becomes increasingly able to apply literacy skills to health-related materials such as prescriptions, appointment cards, medicine labels, and directions for home healthcare. Advantages to the pharmacists include greater satisfaction with the fulfillment of their professional duties, adding to improved patients' confidence in their service, and other healthcare professionals' approach and recognition of pharmacists' work. Pharmacist-led counseling should be an intervention directed to patients' health-related needs that contribute to reduced morbidity and mortality related to drug therapy while improving interprofessional and inter-institutional communication. Next we will discuss interpersonal skills in counseling. To be able to assist patients' best health-related decisions and influence behaviors such as medication adherence, counseling should entail a clear and objective interpersonal communication. However, to professionally address patient counseling, pharmacists' education and training should go beyond effective communication principles to embrace relationship skills. To deal with all health-significant aspects, pharmacists need to properly respond to patients' emotions, aiming to achieve a greater understanding of the patient's biopsychosocial details within the present health condition and treatment. There are several communication-related features necessary as the scaffolding of a counseling session. The starting point, as well as a basic underlying feature, is mutual trust. This means both dialoguing persons must believe in the other just as in themselves. The pharmacists must respect the patient's autonomy to make decisions by adapting his or her professional knowledge and actions to patient's needs. Respecting the patient's rights and willingness, and establishing his or her co-responsibility in the counseling process, is the cornerstone of patient counseling. The pharmacist needs to recognize the patient's trust and the acceptance of the pharmacist as a counselor. Otherwise, effective counseling will be difficult or even impossible to achieve. Another critical interpersonal skill is empathy. There are several empathy definitions, including the capacity to place oneself in the position of the other. The professional understands and accepts without any attempts to stop, modify or block the ideas or the emotional content that the patient is disclosing. By feeling acknowledged and secured, the level of detail in the exchange increases, thus enhancing the chances of providing optimal counseling. There is evidence illustrating that an empathic relationship between pharmacists and patients improves pharmaceutical care outcomes, including medication adherence. The empathic behavior should be expressed both verbally and non-verbally. While clear spoken or written language supports effective verbal communication, empathy also requires mastery of the non-verbal communication signs. One main feature for reaching empathic resonance is the quality of paralanguage, in particular, voice features, i.e., how one sounds to the other. The pharmacist should reduce the pitch and decrease the speaking rate if wanting to be perceived as an empathic person. However, a warm voice alone does not turn an unwelcoming pharmacist into an empathic one. Verbal responses need to be preceded by active listening and other effective communication behaviors, e.g., an open body position and an interested look. The empathic pharmacist should listen with the eyes, to not miss any emotional disclosure. This is a difficult exercise as listening to all empathic opportunities is harder than e.g., asking good questions. Empathic listening also requires physical proximity within a mutually accepted interpersonal distance, full attention to non-verbal information without interruption and showing respect. Empathy also requires attention to one's own body language to avoid emotional signals of disgust, disapproval or annoyance. In short, A good counselor requires interpersonal qualities such as being approachable and welcoming, friendly and warm, a good and tolerant listener, well-focused and self-confident, available to spend time with the other and assuring full confidentiality. Next we will discuss pharmaceutical counseling in practice. Essential elements. The pharmaceutical counseling is an interaction between two or more persons, preferably between a pharmacist and a patient, usually in a pharmacy setting. It should start with the patient first sharing a health issue and the professional providing information that comprises possible solutions, their advantages and limitations, so the patient is able to make an informed decision. The pharmacist helps the client to identify, clarify and resolve potential or existing doubts. Concerning therapy issues, the pharmacist should work to guarantee that after the counseling the patient or caregiver is able to show the agreed level of therapy management. Next we will look at counseling basic principles and conditions. Let's begin with 1. Professional hard skills. Pharmaceutical, health and social related knowledge. 1.1. Pharmacotherapeutic and health information, e.g., ill health conditions, drugs, clinical practice, etc. 1.2. Population and social-based information, e.g., prevalent health issues, healthcare organization, community and individual resources, including cultural and economic, etc. 2. Professional soft skills, interaction competences. 2.1. Managing personal barriers, e.g., hearing limitations, different mother tongue, etc. 2.2. Facilitating patient autonomy, e.g., personal attitude with appropriate levels of empathy and assertiveness, etc. 3. Environmental conditions, local setting and organization. 3.1. Avoiding physical barriers, e.g., safe and private counseling area, etc. 3.2. Using educational resources, e.g., printed materials, simulated devices, etc. Main pre-existing conditions can be divided into pharmacists' knowledge and skills, as well as on environmental conditions. Knowledge of pharmacotherapy needs to be complemented with knowledge of the diverse cultural and individual backgrounds of patients. The pharmacist should be attentive to patients' attitudes towards the healthcare system as well as patients' own roles and responsibilities for decision-making and self-management. Counseling relies on a certain degree of patient's autonomy not functioning at its best in fully paternalist care environments. Communication competences are tested when social and cultural differences or system barriers, e.g., shyness and other personality traits, forced spatial separation, unclear organizational structure, or physiological limitations in language use and comprehension, e.g., hearing difficulties, poor eyesight, ill health and psychological distress, exist. Effective communication also requires controlling for communication noise, from obvious environmental sources, surrounding sounds, to syntactical, wrong grammar, and semantical, diverse interpretations, noises. The physical setting here comprises all features that facilitate patient involvement and learning, i.e., a space that is comfortable, seating position, confidential, enough privacy, and safe, accommodating significant others, if required, including conditions for disabled patients. The desired level of privacy should be guaranteed before initiating the counseling session. Other environmental resources include equipment such as learning aids, e.g., 3D real and virtual models, printed information, e.g., leaflets, charts and graphics, medication administration devices, memory aids and audiovisual resources. Next we will discuss pharmaceutical counseling in practice. Essential process steps. Effective counseling requires several preconditions and process steps to build trust in the counseling, contributing to a safe and caring environment. Maintaining confidentiality is a precondition of effective counseling. The first step is to assess what the individual already knows. The pharmacist should never guess or assume what a person knows or does not know about the issue being discussed. This requires patiently asking questions and listening to clearly understand what the individual is saying or wanting. The empathic pharmacist is non-judgmental and supportive of expressed feelings and fears. You want a true individual account so that a useful solution is offered. Avoid the use of directive communication, i.e., where multiple options exist. The pharmacist should never lead the patient towards their own preferred option. GATHER is an acronym for a structured approach to counseling that is simple to implement in the pharmacy setting. Regarding greet, the pharmacist should always greet the patient on arrival to make the patient feel welcome, to make them comfortable and to start building rapport. At the initial exchange, e.g., welcoming the patient at the counter, the pharmacist should determine the primary spoken language, ask the main reasons for the visit to identify the purpose of the counseling and approximate the expected length. At this point, the pharmacist should invite the patient and any appropriate companions to a more private space, ideally a dedicated space or consultation room. Regarding ask questions in a friendly manner and using words the patient understands and listens attentively, without expressing judgment. Identify what the patient already knows by asking relevant open-ended questions about personal, social, family, health or medical conditions, and therapy or medications. In a following section, examples related to drug-focused counseling are provided. Regarding tell, provide relevant information to help the patient reach a decision and make an informed choice regarding the health or medical issue. Be neutral in manner and content, presenting the advantages and disadvantages of each option without stating your personal preferences, unless requested by the patient. Regarding help, assist the patient to reach a decision, without making choices for him or her. If needed, provide additional and related information so until no doubts persist. Regarding explain, once a decision is reached, provide all required information and details to empower the patient regarding the option made, including confirmatory questions ensuring patient's learning. Regarding return, the last step recommends a follow-up after a period. The time elapsed to the return session varies with the counseling initial session's objectives and patient commitment. For instance, non-drug counseling for diet improvement does not need a specific return time, while using a medical device for the first time might require some feedback from the patient soon after dispensing. All counseling may present challenges. Difficult moments can occur if the patient stops talking, either as a result of a confidentiality concern or perceiving a judgmental attitude from the pharmacist. Emotional expressions, e.g., crying, are also challenging. Use a pause to allow for patient's emotional recovery, offering relevant physical support such as a tissue, glass of water or a seat. If the counseling has become inappropriate or ineffective to close the session, the pharmacist can show loss of interest, e.g., standing up, working with the computer or handling other documents. There will be times a pharmacist cannot provide an answer due to lack of knowledge or feeling embarrassed by the subject matter, especially with acquainted patients. In this case, it is recommended to refer the patient to a colleague or other healthcare professional. And now we will look at pharmaceutical counseling and medication adherence. Counseling is a patient-focused intervention designed to improve behaviors like medication adherence and persistence. Adherence can be defined as the extent to which a person's behavior, such as taking the medication, corresponds with agreed recommendations from the healthcare provider. This usually involves the voluntary collaboration of a patient in a mutually accepted course of action. In fact, from practical, emotional and unidimensional social support, comprising family cohesiveness and conflict, marital status and the living arrangement of adults, practical support bears the highest correlation with adherence. See Chapter 5 for more considerations around adherence. In medication counseling, all previous principles, requisites and gather steps should be respected, with content-specific counseling always adjusted to patient existing knowledge. When the patient is using a medication for the first time, the initial questioning should comprise patient's understanding of his or her health condition and the medication purpose, followed by information on what to expect. In medication refills, ask the patient how he or she is using the medication, including demonstration, if required, and to describe any issues being experienced. Although the previously described approach is most times enough to assess patient knowledge on medication, when aiming at a more detailed counseling, the following topics should be covered. 1. Name and purpose of the medication. 2. The dosage, quantity that should be taken, when to take it, for how long. 3. How to administer the medication, including preparation, if needed. 4. What to do when a dosage is missed. 5. Precautions when taking the medication, e.g., renal and hepatic impairment, drowsiness and driving, exposure to sunlight, etc. 6. Important side effects, e.g., gastrointestinal malfunctioning, e.g., diarrhea, vomiting, CNS disturbances, e.g., sleep disorders, nervousness, etc. 7. Interactions with foods, beverages, other medicines. 8. How to store the medication at home. 9. Proper package and leftovers disposal, if appropriate. 10. How to self-monitor effects, if possible. And 11. How to refill the prescription, if necessary. Pharmacists engaged in medication counseling should assess their counseling success. This requires more than satisfaction queries, but should materialize in follow-up sessions. These sessions should follow a line of inquiring covering how the patient is using the medication, including his/her demonstration, if required, and to describe any issues being experienced, before any advice itself. To better achieve a useful follow-up, pharmacists must develop and implement a plan to monitor patients' progress, detecting risks and employing the measures needed to achieve the agreed outcomes. On the other hand, patients should attend these follow-up sessions. Documentation is essential to accomplish the counselor role and to demonstrate the quality and effectiveness of the service if requested by third parties. Many times, under routine and time pressures, pharmacists are not immediately able to initiate a dialogue conducive to decide on patients' eligibility for medication counseling. This way, it is good to develop a priority checklist, according to local patients and setting. For instance, polymedicated patients, those receiving for the first time a new drug and those looking confused or known to have visual, hearing or literacy limitations, should be the priority for an initial screening interview. Other patients should also be surveyed for medication counseling, such as those receiving important changes in medication or dosing, complicated directions, significant side effects and special storage requirements. A note should be mentioned regarding the advice giving in helping patients with minor ailments, designated as counseling non-prescription drugs. Responding to patient symptoms, and confirming the opportunity to treat a self-limited condition, should entail a structured patient interview with the principles and conditions earlier mentioned, preferably based on self-medication protocols. Otherwise, handling a specific OTC product request and providing direct information is different by nature from the counseling here proposed. Finally, any patient counseling needs to respect patient autonomy, to keep data confidentiality, to serve patient welfare, always treating those who have searched for professional help with respect and compassion. Thank you.